This is Nick Casimia, and I'm here with Director of Magnet, Steve Gibson. Hello.
Hi. Hello.
So let's talk a little bit about Magnet. Magnet's been around for 10 years, and what is its mission statement?
Magnet's mission is to promote the health and well-being of gay men in San Francisco.
And it's a not-for-profit clinic, correct?
It's a health and community center, really.
Mm-hmm.
We opened 10 years ago. We were initially part of the University of California, San Francisco, and we joined the San Francisco AIDS Foundation 6 years ago. But so the whole concept was to have a retail space in the Castro that was very open to the public, that offered integrated sexual health services, so HIV testing and STD screening and treatment, as well as hepatitis A and B vaccines, all in a community-based setting. So an open lobby that can serve as a waiting area and reception for our clients, but can also turn it into an art gallery. We rotate art shows once a month and have art openings. We have a book club that meets monthly, and we have an open mic night that performs every third Wednesday.
The big topic of sexual health today, as it was 30 years ago, is HIV, correct?
Yeah.
Do we have any idea about stats in regards to HIV infections in this day and age?
Yeah, actually San Francisco, in the United States, HIV is increasing among gay men and other MSMs, the only population where HIV rates are going up in the United States, except in San Francisco. In San Francisco, the rates are actually going down. We're very fortunate that we've had really good programs in place for 30 years now, and we've managed to kind of buck the trend in terms of rising rates. So HIV rates are going down in San Francisco, and that can be attributed to a couple different things. Increased testing. We got a big grant from the city a couple years ago to really dramatically increase our testing. We were doing about 4,000 HIV tests a year before, and now we're going to come in about 9,500 HIV tests this calendar year, 2013. Wow. And then the other thing that we're doing really well in San Francisco is when somebody's diagnosed with HIV, we're more successful at getting them linked to care sooner and helping them stay in care longer. So in San Francisco, the trend now is that I think it's about 50% of people who've been diagnosed with HIV have suppressed a virus 12 months after the diagnosis. So they're able to find out they're positive, get to a doctor, and stay in care for a 12-month period to reduce their viral load.
Wow.
And in San Francisco, we look at that and say 50%, and we scratch our heads and say, why isn't that better? But the national average is about 25% who have viral suppression after diagnosis.
Wow. In regards to the fact that San Francisco is such a hotbed of not just gay men, but gay men's health, and such a focus on, as you said, like testing and also focus groups, PrEP. What is PrEP?
So PrEP is the use of Truvada, daily dose of Truvada, to prevent the HIV acquisition from somebody who's HIV negative. Mm-hmm. So somebody would take a pill to avoid getting infected with HIV.
And what is your stance as somebody who runs this clinic, which is a men's health clinic, on PrEP? Is PrEP a good thing?
Yeah, it can be a good thing. It's kind of we don't prescribe PrEP right here. We don't have the physical space to do that, or the staffing structure in place. But during the IPREC study, which was the formal study of PrEP, we're looking at PrEP versus a placebo. San Francisco is one of the 2 cities in the United States that was involved in the study. And when it found that it had really high success rates, efficacy rates, they then started what they call the PrEP demonstration project, which is being done at San Francisco City Clinic, not here. And that was basically to look at what does PrEP look like in the real world. In the clinical trial, there are very strong regimens in the clinical trial. Being screened for HIV and STDs every 3 months, counseling about using condoms, and then we know and that was before people knew if they were on the medication and if the medication worked. And when we found out the medication worked, we're like, okay, well now what's that going to look like in the real world? So City Clinic enrolled 300 men into the demonstration project to see now that we know that it works, what does it look like in the real world? So our policy here is if you think PrEP would work for you, then you should find out about getting on PrEP, either through the demonstration project or through the primary care doctor. So we don't say yes you should or no you shouldn't, but we help people understand what it is and what it's not, and when it can be effective and if they might be a good candidate for it.
So this leads me to ask you, when is PrEP effective and when is it not?
Well, I understand you have interviewed Dr. Grant.
Not yet.
Okay,
So I'm asking you
okay.
point blankly. I mean, what is your take though? Because you guys have to obviously counsel men. I mean, is it case by case?
It's always case by case. Yeah, it's case by case because some people will want PrEP and benefit from it, and therefore they should probably seek it out. And some people may feel like it's not really going to have a significant benefit for them, so there's no real need for them to do it. Mm-hmm. So it's always case by case. I make a couple analogies. First off, is the PrEP and oral contraceptions for women. Because when the pill first became available and women were going to use the pill, there was a lot of case that somehow that was going to cause women to be more sexually promiscuous or take more, have more partners, or somehow that was going to be bad. Well, unplanned pregnancy is not necessarily a desired, public health outcome. And so anything it can give to a woman to control that, because not all male partners are going to use condoms. So giving the woman the power to exercise control over her body is a good thing. Now, whether or not she uses it or not is up to her. So I kind of think of PrEP as being somewhat similar. Here's what we know about PrEP. It may work for you or it may not. I think in the clinical setting here, there are some people that come in who already know about PrEP and they're asking about it. Those are mostly guys who are either weren't involved in the study or have a partner who's HIV positive. So if our guy comes in and he's HIV negative, it's like, well, my partner and I we're using condoms, but I'm really worried about still getting infected, so should I go on PrEP? We're not going to say yes, you should. We'll say this is what you should think about and where you can get it. Or we're thinking about not using condoms and want to go on PrEP. What do you think about that? We can't tell them, yes, you should or you should not do it. We can give them the information and say, this is a decision that you and your partner need to make together. I think the group that's coming in here is, if people are coming in with rectal infections every 2 or 3 months, or they're coming in and not really sure what happened the night before, so they may not be good at using condoms, but they're good at accessing healthcare, that's a really great candidate, because you want somebody who may not be the best at using condoms to protect themselves from HIV, but they can access healthcare services. So they could come in routinely every 3 months to get tested. We can tell people what PrEP is and whether or not they would benefit from it or not, and then give them the information so they can make a more informed decision. Oftentimes you have guys coming in who may want to talk to the doctor about PrEP, but they don't know how to talk to the doctor about PrEP, because either they don't see the primary care doctor that often, or they try to talk to the doctor about PrEP and the doctor didn't know about it, or the doctor said, well, you shouldn't do that, you should use condoms. Because there still is a lot of homophobia in the medical system, including there may be some gay doctors who think that gay men should always use condoms. So I see it in our job is to do some education to the patient about how to be their own advocate with their primary care provider.
Given what you just said, which I think is really true, actually, is a lot of men do not feel comfortable even bringing this up, and a lot of doctors are not informed about PrEP, because PrEP is a relatively new invention. What do we know about PrEP in terms of its success rate? What is your take on it?
We had Dr. Grant come and do a little in-service with the staff and volunteers a couple of months ago so that the staff here and volunteers could hear directly from the researcher's mouth, so to speak. And so we know in the IPREC study, overall efficacy was around, I think, 42%. But that was everybody enrolled in.
Sorry, 42% success rate.
But that's in the entire study group, right? Okay. Dr. Grant will give you more of the expertise on this. But that included people who were enrolled in the study but never took a pill. But then if you start looking at the data from people who took the medication and who were adherent to the medication, the efficacy went up to 96%. So people who took the pill every day as intended had much higher rates of efficacy about not getting infected.
That's amazing.
Yeah.
Isn't that great?
I mean, that was a standard that I think exceeded everyone's expectations.
So why do you think it's been so controversial?
I guess it depends on who's it controversial to.
Well, for example, the AIDS Healthcare Foundation.
You'd have to talk to Michael Weinstein about that.
Well, I actually spoke to Dale.
Dale Gluth, right.
Yeah, earlier today. And I mean, they've been very vocal. The AIDS Healthcare Foundation has been very vocal of its criticisms about PrEP.
Right.
They believe it's still too young. It's infantile in terms of its research, in terms of the studies, in terms of how effective it is. We're not quite sure of its side effects, which is true. The study is relatively new.
But the medication has been used on people with HIV for many years.
Yeah. But they're with people with HIV.
Correct.
Versus people who are...
Right, and so the side effects from Truvada are very, very small, and research is ongoing now to look at other ways of administrating PrEP or other medications that can be used as well. So going from a daily pill to possibly a monthly injection or even a quarterly injection. So there are other ways that the research is moving forward to find it easier to adhere. It's all behavioral, right? People talk about condoms as being behavioral. Taking a pill is behavioral. So that's still there, and even taking a pill once a day may not be the easiest way for some people to do it. So they're looking at other ways. With all due respect to the AIDS Healthcare Foundation, they're the only organization that's being critical about PrEP. So I'm not certain if you should listen to that one voice rather than the other research and the other voices out there that are talking about PrEP, the efficacy and the benefits of PrEP.
What do you think the AIDS Healthcare Foundation is so vocal in their advocacy against PrEP? They're a not-for-profit who is a very, very kind of incredibly important force of HIV research and AIDS funding and whatnot.
There are lots of national organizations that are strongly behind the research and science talking about the efficacy of PrEP.
And let me ask you this, in regards to PrEP in general, do you think this is a good thing? Because, I mean...
Yes.
Really?
Yeah.
Point blankly?
Yeah. Anything that can reduce the likelihood of somebody getting infected with HIV is a good thing.
Yeah.
Why not?
What's the critic? Why then? I mean, I remember when this was first launched. I mean, it made Time Magazine's top invention of the year, medical invention of the year, which is no small feat.
Right.
Obama called up, Why then has this been so murky? Why are only 6 people? Like we spoke to Nurse Tim and said only 6 to 8 people a week come and ask about PrEP,
Right.
which is a very small stat given the influx of people that come in here. This should be. It's like condoms. Like, why not use this?
Right. Well, part of it is that there's not been a lot of education outside of the research world to talk about PrEP, right? Mm-hmm. The FDA approved it, so Truvada's been approved now for use for PrEP. But there's not yet been a lot of campaign talking about that. Gilead, who manufactures the medication, has said they're not going to do any direct-to-consumer marketing about this. This is not they're not pushing this.
Why not, you think?
Because they don't want to be accused of being in it for the profits that are associated with it, which is what AIDS Healthcare Foundation has largely been critical of, is the profits. And Gilead is saying, look, we're not going to do that. We're not doing direct-to-consumer marketing about it to tell people that they should take it, because it's up to the individual choice level for people to choose whether or not they want to go on PrEP. So I think we need to educate the population that it exists, that the research is out there that talks about its effectiveness, but then also do some education around providers about PrEP and what they should know about PrEP and how they should be able to be advocates for their patients' health. So, when Dr. Grant was here, one of our volunteers said, well, one of my guys last month said he was thinking about stopping using condoms and wanted to know about PrEP. And Dr. Grant did a really great way of rephrasing that, because Dr. Grant kind of challenged our volunteer and said, well, when he said that he thinks he was thinking about stopping using condoms, he already had. Mm-hmm. He was asking you what you thought about that. Mm-hmm. Right? So that was something for him. He was making a decision to not use condoms and wasn't sure about that, wasn't comfortable. And then to tell that to another provider, for 30 years we've gotten messages that you use a condom, use a condom, use a condom. And it's irresponsible to not use condoms, right? A lot of us old guard, condoms, when the FDA and the CDC and Washington was not paying attention to us and gay men were dying, we were the group that rallied around our own health. Mm-hmm. And condoms were our advocacy, they were our support. And so it may feel disingenuous now to talk about condomless sex and still having protected sex, right? Because PrEP is the protection without the condom. Mm-hmm. So the idea now that we have to evolve and change our thinking about that is a challenge for people. But it's okay, it's a good challenge. It's a healthy dialogue. It's where we are in the course of the epidemic now. We didn't get from several thousand infections a year in San Francisco among gay men to 400 infections a year among gay men because without the community's efforts, the gay men getting behind, we reduced HIV among gay men in San Francisco. PrEP is another step that can help us further reduce it. So why shouldn't we explore that? And not like fluoride in the water, but talk about who would benefit from it, who wouldn't benefit from it. If you don't get fucked, you may not need PrEP. If you get fucked all the time and don't use condoms, PrEP might be a good thing.
Mm-hmm. I know you just said it, but I want to talk about some specific stats. You just used them right now. So in terms of HIV infections today in San Francisco, what are they?
Infections versus diagnoses are two different things, right? Okay, so diagnoses in San Francisco in 2012 was about 413. I'd have to double check the exact math, but about just over 400 diagnoses in San Francisco among gay men.
That's a pretty great low stat, isn't it?
Yeah.
What's the national average? Do you know?
Gosh, I don't.
Okay.
Don't know that.
Okay. But
I'm the San Francisco guy.
Okay, that's fair. That's great, though, isn't it? That means like what you guys are doing and what all the clinics here are doing, it's working.
Yeah. San Francisco really shifted its focus a couple of years ago in terms of the Department of Public Health, that they're going to focus on 3 populations, really. Gay men and other men who have sex with men, transgendered women, and people who inject drugs. Mm-hmm. That those were the 3 at-risk priority populations. So the city really said we need to ramp up testing in these populations, which is why Magnet got a large grant to really dramatically increase our HIV testing. We're doing 2 types of HIV testing here at Magnet. We're doing HIV antibody testing for all HIV negative gay men. And if people are HIV antibody negative, we're then doing a viral HIV RNA test. So the antibody test is a test that looks for presence of the antibodies. So it's a traditional test. Mm-hmm. If somebody's been exposed and infected, they develop an immune response, which is the antibodies, and that test looks for the antibody response. It's a very effective test, but it looks for an antibody infection. It's possible that there can be guys who've been infected with HIV very recently, and they're antibody negative because the body's not yet launched an immune response. So the antibody test was negative because there weren't antibodies present or detected, but there can still be HIV present and replicating. So we do a second test called an HIV RNA test or a viral load test. Okay. And that's the test that actually looks for the presence of the virus. That's a lab-based test. The antibody testing we do is rapid or point of care, so it's done on site. Mm-hmm. But for anybody who's antibody negative, we send a tube of blood to the Department of Public Health laboratory for them to do a HIV RNA test.
Is one of the fears of PrEP that, once one takes it, they become immune, perhaps, as their body becomes?
I don't think that's a fear about PrEP. At least that's not what I've heard. That's not what I'm hearing about the concerns. I think the concerns are, very specifically, if and in the clinic, when we have somebody come in, it's like, my boyfriend's HIV positive, we don't want to use condoms, we want to have unprotected sex, I want him to come inside me. Mm-hmm. That's a really difficult situation to be in and say, give the official green light and say, yes, by all means, go for it, go ahead. But we know that two things. It's not just PrEP, it's also viral load, right? So if the boyfriend's HIV positive and has suppressed a virus, we know the likelihood of him transmitting the virus to anybody is decreased, right? Because viral suppression means it's less likely to transmit. And then if you add PrEP on as a secondary layer of protection, and this couple has a desire for physical and emotional intimacy, why should that be denied?
Well, I was looking downstairs because we were, in the clinic earlier today, and I didn't see any PrEP advertising, or let alone even flyers. Are you guys a little hesitant to go there just yet?
The demonstration project wrapped up, and we took the flyers out away because of the demonstration project. So we used to have those out, but we don't have them out now because the demonstration project rolled up. It's really stuff that takes place during the counseling sessions.
Right. Is that brought up in the counseling?
Yeah.
So let's say I'm a man who comes to your clinic and says, I'm exploring these options of, I have regular sex with a number of partners. Sometimes I use condoms, sometimes I don't.
Well, what's most likely going to be different about how we do counseling here is we ask, so are you having a good time?
Of course.
Great.
Yeah.
And then talk about what are your concerns, right? Because if people are using condoms consistently they're not using condoms with their primary partner, but they're having sex outside the relationship, and they're using condoms in those relationships. Talk about what their real concerns are versus what their fears might be, right? The oral sex is the biggest thing, for example, that people are really freaked out about oral transmission of HIV. We can really put their minds at ease about that. But then say, hey, did you know that syphilis rates are really high and you can get syphilis in your throat from sucking dick? Make sure to educate about that. If they come in and they're not good at using condoms, they've had several rectal infections the last year, or they've come in twice looking for PEP, which is different than PrEP, or we know that they just don't want to use condoms. They've decided they don't want to use condoms. That's when you can open up the conversation about PrEP and its potential benefits and say, well, there is this new medication now. It's called PrEP. They may have heard it, may not have heard about it, but then start to explain to people what that looks like and what that is. And then if they express an interest in that, we let them know we don't provide that. But this is where you can access it. If you have a primary care provider, you can go to your primary care doctor and ask about it, or you can get onto Healthy San Francisco and get it here, or go through Gilead's Compassionate Use Program as well.
This is my final question, but are you concerned at all this is a bit of a Pandora's box? Because condoms, apart from, HIV and other, they actually work for other diseases as well.
Sure.
And PrEP is effective only for
HIV, correct.
HIV.
But it's the box was open a long time ago.
Really?
Pandora's box is open a long time ago. Managing condoms was not a normative behavior. Physical intimacy during sex is normal, right? Trying to manage HIV for 30 years is not normal, right? But for 30 years, that's how we've learned to express ourselves sexually. But so now, physical intimacy is it's pleasurable, it's desirable. Why should people not engage this? Then how do you manage diseases is the conversation. And similar like to PrEP and HIV, we do tell people that there are other STDs that you can get, but people are already getting some of those other STDs. Like we have very high rates of syphilis in San Francisco right now. So it's important to talk about the benefits, both the benefits in terms of protection for both HIV and other STDs, what will and won't work, right? PrEP won't work for syphilis, but if you're sucking dick and don't want to use condoms, you can still get syphilis that way. Versus the benefits of physical intimacy and what people are looking for in terms of sexual expression and connecting with somebody else. So it's helping them understand that it's not just about not getting a disease, it's about having an overall, what's your sexual health? That if you talk about health in that way, you can find what's really motivating for people and then help them understand what's the best resources for them to make certain, not that they're just not getting a disease, but they're having good sex.
That's great. So thank you very much.
You're welcome, thank you.